time to talk about troubleshooting of Foley catheters. But before that, the best way to troubleshoot is not to have to troubleshoot, which means before you place a Foley catheter or any type of urinary catheter, we should ask ourselves, do we have the proper indications for that? And if we need a catheter, can we go by just an external catheter instead of an invasive catheter? The third thing, make sure that we don't have a contraindication to place that catheter. Placing urethral catheter are contraindicated in urethral injuries. At any point, if you see blood at the meatus, please do not place a catheter, urethral catheter, and call urology. If there is any suspicion at any point of urethral injury that comes with pelvic traumas, even if you have a very low suspicion, please call urology. Also, ask the patient. Unfortunately, this may not be that realistic because in US, these Foley catheter mainly placed by nurses. But nurses and us, we should ask the patient if he ever or she ever had a Foley catheter before, and if it was difficult to place, or if they have to call urology for that procedure, or if the patient had a recent urological procedure or has a history of urethral strictures. In these cases, we should save ourselves all that time and call urology. Also, if the patient has a Foley catheter already, we should always ask ourselves, is there a reason to keep it in? And if not, please remove it as soon as possible. We should do everything possible to minimize the complications that comes with a urethral catheter or invasive catheter, like urethral injuries and infections, all these things. So that's the best way to troubleshoot, is to avoid the whole troubleshooting problems and avoid having that catheter.